gals. Welcome to Breakout 2 after lunch. So if you need to stand up on the outskirts of the room, this is nice and cozy in here. So nobody probably gets to take naps in this room, but if you are a napper, this could be a real problem. So feel free to stand up in the back. I get the pleasure of reading a very short bio of Alex, but Alex is joining us for this wonderful session that we're super excited about. She is a family nurse practitioner. She's been practicing for 13 years, and she is very passionate about empowering women of all ages to understand and take care of their physical health. So with that, I invite you to welcome Alex to the stage.
Hi, you guys. I am from Oklahoma, so I am a hey y'all, I'm Alex kind of girl. So hey y'all, I'm Alex. I've been a family nurse practitioner for about 13 years, RN for about 25 years. So just want you guys to know where you're getting your health information. I think that's important. Y'all, social is great for like cat videos and how-tos, but please do not depend on social alone for your health information. There is some really great stuff out there. There's also a lot of garbage. So please, 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 I'm going to give you a list at the end of some reputable resources for health information that I want y'all to use, but just wanted you to know where your information is coming from today. Okay, I've got a couple of disclaimers that we've got to get through, so if you would please, next slide. All right. Anybody in here under 16? No, we're good. Next slide. All right. Everything I'm going to tell you guys is based in clinical practice guidelines, recommendations from health experts, my education, and my clinical experience. Doesn't reflect the opinions of Westside Family Church, the leadership, or my employer. Okay? All right, next slide. All right. We'll get there in just a second. Okay, privacy information. You guys, I love questions. I love open discussion, but please know that I really would rather you not communicate anything that is private and personal to your health. I can't guarantee confidentiality. The session's being recorded, so just be very mindful of anything that you ask me. I just want you to be careful. Fair enough? All right. And then finally, oh, yeah, we're good. Okay. Can we advance a couple, please? Okay, this is a great place to start. All right, so I spent a lot of time thinking about what does it actually mean to be blessed in health? Is that the absence of disease? Does it mean not getting hurt? Does it mean having resources to deal with your health? Do we still feel blessed when it all goes south, when our physiology is misbehaving, when we're not feeling well, when we're having health hardships? So we're going to talk a little bit about how to find the blessings even when your physiology not really cooperating, okay? Next slide, please. So today what I'd like to do is just try to empower you. I want to empower you to make your physical health a top priority. I want to help you recognize some common things that just aren't right. I want you to advocate for yourself when you need help. More on that. And I want you to feel blessed even when your physiology fails by the end of our session. Okay? Next slide. All right. So, ladies, we as women are amazing and tireless advocates for everyone but us. Think about that. How many times have you sacrificed something that you needed for your health out of, oh, but I'm so busy. I've got this to do. I've got that to do. I've got to take care of this. Somebody else needs that. That needs to stop, and we're going to talk about why. Okay? All right, so let's track those periods. Why? Because if you come and see me and tell me something's wrong, the first thing I'm going to ask you is, when was your last menstrual period? And half of you are going to look at me and go, all right? So it's super important you track those cycles. Some things that are normal, we can go ahead and advance slide. All right, periods usually start between the age of 10 and age of 16. Anything before that or anything after that needs to be looked into by a healthcare professional. Cycles generally last, periods will come on between 21 and 34 days. If they're happening more often or less often, let's talk about it. Period length, about 3 to 7 days. Flow, about 1.5 ounces to 2.5 ounces. And I know some of you are looking at me thinking, yeah, when has that ever happened? But seriously, you should not be losing a cup of blood a month. That's not normal. You should come talk to us, okay? Small clots, not golf ball size clots, mild to moderate cramping, mild and short-lived irritability, and periods are generally going to stop somewhere between the ages of 45 and 55. Not always, but generally, okay? Next slide, please. So menstrual cycle concerns. Before age 10 or after age 16, something's going on, we need to talk, okay? Irregular cycles, depends, right? Lots of things affect our cycles. If your cycles are occasionally irregular, that's okay. If you're going 3, 4, 5 months between cycles, that's not normal. You need to come talk to us, okay? Heavy bleeding. If you tell me, Alex, I change my pad, tampon, or menstrual cup every hour for the first 3 days I'm on my cycle, not good. That's not normal. Let us know. Large clots or other tissue passage. Clots should be no bigger than your thumbnail. If you're having clots that are bigger than that, could be a uterine fibroid or something like that, you got to come and see us, okay? You should not have pain that keeps you in bed. If you are not going to school, not going to work, not going to church, because you're in such severe pain from your menstrual cycles, not okay, okay? Your family should not want to move out 1 week of every month, okay? If your family's like, oh, what day on the calendar is it? We got to go. Not normal. Don't do it. Next slide, please. Oh, perfect. Okay. Things that affect our periods, our genetics. It does play a role. It has to do with the hormones and how they're released and how they're interpreted in our bodies. Now, does that mean that just because your mom went through menopause at 51, you're going to too? No. But it just has something to do with it. Disease processes, things like PCOS, endometriosis, thyroid issues, those can all affect our endocrine cycles, our hormone cycles, our periods. Medications. So many of the medications that we take, you guys, affect our menstrual cycles. So if your cycles get wackadoo after you start a new med or after you stop a med, it may have to do with the medicine that you are taking. Let's talk about it. Stress. Nobody in here is stressed, right? We're all like totally chill and everything's fine and we're getting like 9 hours of sleep at night and everything's good? No? Okay. Stress, we'll talk about this kind of briefly because we're going to hit it in several other sides. When you are stressed, your body releases a flood of stress hormones, cortisol being one. When we are stressed, because of the impact that cortisone has on our endocrine system, that can delay our periods. So have you ever known anybody that was in the process of getting a divorce, for example, and then freaked out because they missed their period and they thought they were pregnant right as they were going through a divorce? I have. Wasn't pregnancy, it was stress. Okay, so those kinds of things. Exercise. For my women, and typically my younger women that exercise a lot, like spend 2-3 hours a day in the gym, your exercise can actually impact your periods. It can delay your menstrual cycles. So that is something. Nutrition. Eating disorders specifically. If you have lost a tremendous amount of weight very quickly, or if you are someone that you know has an eating disorder, your body can't menstruate if it's undernourished. So that can certainly impact as well. Pregnancy obviously affects periods, so does breastfeeding. So be mindful of that. I'd like to make a quick plug on breastfeeding and pregnancy. So we used to think that if you were breastfeeding, you could not become pregnant. Spoiler alert. Lie. They lied to you. Lots of people have Irish twins because of that. So that is not true. So just know that. But guys, you're going to hear me say this a whole bunch. The rule with women's health is when in doubt, check it out. Seriously. 100% of the time. Do not suffer silently. Do not be a women's health martyr. Okay? Don't minimize your symptoms. Don't discount what's bothering you. Don't feed into the, it's not that bad. If you are concerned, come see us. We can help you. There are medicines that can help regulate menstrual cycles. There are procedures that can help regulate menstrual cycles. There are medications that help deal with the problems associated with menstrual cycles. So you have to talk to us so we can figure out what's wrong, so we can figure out how to help you, but it all starts with you guys coming to see me, okay? Next slide, please. Okay, y'all. There was a lot of debate in my heart on this, but I have to do it. Not every woman easily gets pregnant, carries the kid for 9 months, has a baby, and lives happily ever after. Okay? There is so much in the news and so much in social and so much everywhere about how to prevent pregnancy that we just assume that it's a foregone conclusion. You have sex, you don't use protection, you get a baby, that's it. No, not the case. Not even close, okay? So we're going to talk about miscarriages a little bit. Now, anytime you see in my slides something that says NIH or NHS or WHO, that's citing the source for my statistics, okay? So NIH is the National Institutes of Health, NHS is the National Health Service, that's out of the UK, and then WHO is the World Health Organization. So when you see statistics in my presentation and you see those acronyms or those initials afterwards, that's just letting you know where I'm getting my slides, my information, okay? So, y'all, 20% of documented pregnancies end in a miscarriage. And that's probably actually a pretty significant underrepresentation because many, many women miscarry and they never tell anyone. So this is a super common issue. Miscarriage is about physiology. It is not about fault. You did not cause this. You could not have prevented this. This is a fail of physiology. Don't take it on as you, okay? The majority of women who do suffer a miscarriage can later conceive and carry a baby to delivery. It doesn't mean you're not going to ever have a baby. I will say if you have subsequent miscarriages, you need to come see us. There's lab work we need to do. We need to see if there's something going on. But just understand, you didn't cause your miscarriage. It is not your fault, okay? Next slide. If you suffer a miscarriage, the very first thing I want you to do is to allow yourself to grieve. It is okay. Don't suck it up. Don't drive on. Don't push it down. Don't hide it. You need to grieve. Number 2, reach out to trusted friends and family. Okay, let others pour into you. Y'all, we're all sisters. We all have our struggles. You've got to let others pour into you. See a therapist if you need to. It's normal to be sad, it's normal to cry, it's normal to take time to grieve, it's normal to hurt for a while. But if it turns into severe anxiety and depression around the miscarriage, you need to talk to someone, okay? It is incredibly important that if you have a miscarriage, you reach out to your healthcare provider. You may need follow-up, okay? There are some things that can happen that can necessitate additional medical evaluation and treatment. So just let your healthcare provider know, hey, I think I was, 3 or 4 weeks along, I've had a miscarriage, I'd like to follow up and make sure everything is okay. That's very important to do. And just remember, you guys, this is not your fault. You did not cause it. You are not alone. This is very, very common. Reach out, okay? Infertility. These numbers shocked me. I know it's common. I'm a family nurse practitioner. I see patients all the time that come to me and say, Alex, my husband and I have been trying to get a baby for a year and we just can't conceive. I did not realize the staggering worldwide statistics for infertility. It's just mind-blowing. So 45 million couples around the world in 2023 sought treatment for infertility. Did you guys know it's male and female physiology? It's not just us. We take it on ourselves. Well, gosh, I should be able to do the one thing in the world I'm supposed to do, and that's make babies, right? No, okay? About 50% of the time, it is a female physiology problem, but 40% of the time, it's the guys. And about 10% of the time, there's something wrong physiologically with both partners. So just know that this is a physiology problem, okay? So many causes for infertility. It's impossible to put them on slides. I would have 100 slides that listed all the causes, okay? And sometimes we don't know why. And that's probably the most frustrating thing at all is when fertility specialists have to look at a woman and say, I don't know why. And that's kind of hard to hear. We want an answer. We want an explanation so we can fix it, right? Okay. Next slide. If you are having difficulty conceiving, let's talk about what infertility actually means. If you have been having regular sex without birth control for 12 consecutive months and you have not conceived, that's considered infertility. You need to go talk to your doc. Start with your primary care doc. Please don't come see me and just say, I need a referral to reproductive endocrinology. It might be something as simple as we need to check your thyroid and see what your thyroid gland is doing. Okay? So there's a lot of stuff we can do in primary care first, and then we'll refer you to a specialist. So definitely talk to us. Talk openly with your spouse. Y'all are all grown-ups. Okay. Y'all, sex should be enjoyable. Yes, we're trying to get pregnant. But if you attach so much emotion and stress to, we got to do it right now, I'm ovulating, we got to get pregnant, this is the window, let's do this now. Raises your cortisol, raises his cortisol, takes the intimacy and the marital love out of sex. It becomes a chore, and that makes it difficult. So talk about it, okay? Don't blame yourself or your spouse. And difficulty conceiving is physiology, not fault, okay? So please take this burden off your shoulders and let somebody else carry that for you, okay? If you feel depressed or anxious, please, 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 please see a therapist, okay? All right. Now, based on the group I've got here, I suspect most of you are wanting to talk about hitting that certain age in life, right? Yeah. All right, full disclosure, everyone. I am 50 years old. I will be 51 in April. I am riding the struggle bus right there with you. Doot, doot. Okay. So, I love this quote from Oprah. This is amazing. To me, I find this to be empowering. Hey, blessing in menopause. We get to focus on us for a while. All right, next slide. All right. Y'all, if I had a quarter for every time a patient came into my office and said, Alex, I need my hormones checked, I'd be retired. Do you need your hormones checked? And for most women, absolutely not. I can check your hormones with one question. When's your birthday? If you're between the ages of 40 and 55, I just checked your hormones. Yep, I'm good like that. Reality is FSH, LH, estrogen, testosterone, progesterone, prolactin, all the hormones, they typically will stay normal until you are like knocking on menopause's door, okay? So we can check your estrogen. You're like, oh, Ms. Stigner, I'm having hot flashes and night sweats and, I'm gaining weight and I'm doing all the things. Let's check my estrogen. And then your estrogen level comes back normal and then you're like, so it's not my hormones. Well, yeah, it is. They're just not abnormal yet. We have these fluctuations in our hormones about 5 years. It starts about 5 years before our last period. Lasts until about 5 years after our last period. So if you're already there suffering with me, hold on, girls. We got a ways to go if you're not there yet. Good luck. Okay. All right. Next slide, please. All right. Give me a hand. Who's had a hot flash? Is this wrong or inaccurate in any way? Okay, yeah, hot flashes are a hot mess. Okay, all right, so I ran across this and it just made me crack up. Hot flashes are just night sweats night sweats are just hot flashes that happen at night. They're not separate. They're the same thing. It just wakes you up from your sleep and makes you change your sheets 3 times a night. That's what it is. So what that is it's a feeling of warmth or of flushing. Sweating generally accompanies it. And has anybody ever noticed it's usually just restricted to your upper body? You don't typically get hot flashes in like your feet. Very strange. Can last a few seconds to a few minutes. You can have one a day or you can have one an hour. Or in the case of one of my sweet patients that, bless her heart, she would have like a hot flash every 5 minutes. Bless her heart, yeah. Can happen anytime or day or night. In perimenopause and menopause, this is estrogen withdrawal, my friends. Okay, anybody a coffee drinker? Just me? If you don't have your morning cup of caffeine and you start going, I need my coffee, I need my coffee, I need my coffee. Okay, that's what your body's doing with estrogen. That's what triggers the hot flashes, is that drop in the estrogen levels. Interestingly, hot flashes are the body's way of cooling itself. Does that make sense to anyone? So what happens is your estrogen levels drop and your temperature sensor in your brain kind of gets a little wonky because of that. And then what happens is your body thinks it's getting a little too hot, so it causes a rush of your blood to the skin, because when it opens up those veins and arteries and that blood becomes superficial, it can cool the blood. So that flushing and that hot feeling that you get, it's the body trying to cool itself. And then you guys all know sweating is your body's way of cooling itself, because when you exercise, you sweat, right? Okay, so that is actually what a hot flash is. And then lots of women talk about cold flashes. You guys ever had a cold flash? I've had them. It's the weirdest thing. And this isn't like, those people that are cold all the time because they have anemia or because they have thyroid issues. That's not what I'm talking about. This is like, I'm fine, life's good, I'm feeling fine, and then all of a sudden I have this flush of just chilled that hits me. They're strange. Interestingly, you sweat during those too, so I don't really know how that works, but that's what's going on with that. Okay, GSM, genitourinary symptoms of menopause. I probably talk about this to you guys more than I talk about the hot flashes, because when things are not right, y'all come and see me. Y'all come and see me like, I'm itching all the time. Intercourse hurts. I'm having frequent UTIs. My bladder is leaking. If I sneeze, I have to change clothes. Yeah? Yeah. Okay. This all happens because when those hormones shift, those estrogens and those progesterones, what happens is that tissue, the vaginal tissue, the urethral tissue, all those tissues that were fed by the estrogen, and that helps them stay soft and plump and supple, well, that starts to cause drying, and it causes skin fragility. So what happens is you actually have like shrinking is a terrible, terrible word. Okay, think about a sponge, right? Just a regular kitchen sink sponge. When that sink sponge dries out, it contracts down, and then when you put it in the water, it expands and plumps back up. It's kind of what happens when the vaginal tissues are absent of estrogen. They kind of dry up and contract down. So this does cause pain because your lubrication is affected. You can also have bleeding after sex. I have lots of women that are postmenopausal that come to me and say, there's bright red blood after I have sex. Well, first of all, postmenopausal bleeding always has to be checked out, but a lot of times it's skin tears in the vaginal vault. Yeah, that's what causes that a lot of times. So all of these things, we call them GSMs. I call them something's wrong down there, because that's what everybody comes and tells me, Miss Tickner, something's wrong down there. But yeah, so we can treat these things, but you have to come tell us about them. Seriously, anybody? I have more women in their mid-40s come to me and say, Miss Tickner, you have got to check me for ADHD. I think I have ADHD. I can't remember anything. I can't pay attention to anything. I lose my keys. I go into rooms and I can't remember why I'm there. I think I have ADHD. No, you have perimenopause brain. It's a thing. It's for real. Next slide, please. So your hormone changes really do affect your brain, guys. Like, for serious. It is not a joke. It is very real. It can be very frightening, especially to women that have a family history of Alzheimer's, because we start getting forgetful because our hormones are doing this, and then we go, oh my gosh, do I have early upset? My mom had Alzheimer's. Do I have early Alzheimer's? Probably not. But it's the brain fog, and it's super frustrating. Now, if it is any consolation, if it makes you feel better, once everything kind of settles out about 3 to 4 years post-menopause, that brain fog and that forgetfulness, that does actually get a little bit better. So it's not a permanent state of being, but it's one of the things that I have that women tend to come in very, very concerned about, especially women with those family histories. Women will often have mood swings. Now, this gets a lot of attention because guys make fun of it. Okay? Gosh, are you hormonal? What's wrong with you? Anybody's husband ever said that and lived to tell the tale? Okay. It is very, very common. And if you think about it, it makes sense, because when you are having your regular cycles, your progesterone builds up the lining of the uterus, the progesterone drops, the estrogen spikes, and you get that PMS-y kind of mood swing. But when you're in that perimenopause period, it does this all the time. So it's not a nice, progesterone increases, progesterone drops, estrogen increases. It's not that nice, pretty estrogen-progesterone curve that we see during our younger years. It's kind of wackadoo. And so hormones definitely play a role in anxiety, depression, irritability, decreased sex drive. Yeah, sometimes it is a mental thing of, I just don't have the sex drive because my hormones are shifting and I don't have the testosterone the way I used to. Yes, ladies, you all have testosterone. Testosterone is one of the hormones that's responsible for our sex drive in addition to that of the guys. But it does shift as we get older, so we can have it from that. But also, like, do you want to do something that hurts every time you do it? Probably not. So if every time you're intimate with your spouse, you have pain, you have bleeding, you get a yeast infection after, that doesn't really make intimacy terribly appealing for most of us. And so it really does start to affect our sex drive, which can then cause issues in our marriage if we don't handle it properly. And we're going to talk about the guys too. Hold on. Okay. Sleep. Even if you're not having hot flashes and night sweats, progesterone decrease affects our ability to fall asleep and to stay asleep. So what perimenopausal and menopausal women will also come to me and say is, Alex, I can't sleep. I'm getting like 3 hours of sleep a night. That's it. That's all I got. Well, y'all, sleep deprivation is a torture technique because it's effective. Nobody is at their best when they don't get good sleep. And so that poor sleep that we're having because our hormones get a little wackadoo, that bleeds into everything else too. So that's, I mean, it's just a vicious cycle, okay? And still more symptoms. My hair's falling out, Miss Tickner. I'm growing hair on my face, Miss Tickner. I'm gaining weight and I can't lose it, Miss Tickner. All my joints hurt. Anybody? Yeah, everybody? It's a real thing. But I have good news. There is good news. Symptoms can be managed, and we can do it well. But what does that require? You to come tell me. You got to come tell me. If I don't know that you're miserable, I can't help you feel better, okay? You got to tell us what's going on. Next slide, please. Okay, so things that you can do and things that I want to empower everyone to do as part of taking care of yourself always, but particularly in those perimenopausal times. If you smoke, vape, chew nicotine patches or anything else, please stop. Overall health, cancer, yeah, okay, whatever. But as it focuses on your vasomotor symptoms of menopause, the hot flashes, night sweats, all that stuff, nicotine makes it so much worse. Talk to your healthcare provider. They can help you break that addiction if that's something that you struggle with. Limit the intake of alcohol. Did you guys know that the recommended intake for alcohol is just 1 drink a day for women? Did you know that 1 drink a day does not mean a 9-ounce pour of wine? Okay, 1 drink a day, 12 ounces of beer, 4 ounces of wine, 1 ounce of liquor. That's considered a drink. 1 a day, ladies, is the max. Now, if you don't drink, great. I'm not encouraging you to start drinking. But I'm just saying that if you do enjoy a glass of wine, pay attention to how much wine you're drinking and how often you're drinking. It really can exacerbate all of these menopausal symptoms, okay? Limit the intake of sugary foods and beverages. Sugar hides in fun places. We think about Coca-Cola. We think about candy, cakes, cookies. Did you know that white potatoes, white pasta, and white rice behave in your body exactly like Skittles do? It is a very simple sugar. It breaks down very, very quick. It causes spikes in your blood sugar and your insulin. Whole grain pastas are fine. Long grain rices are fine. But just watch those things that break down into really fast sugars, because that sugar spike and then that sugar drop, that gives you symptoms, okay? We don't talk about this, but we need to. Processed foods. The chemicals that we put in our foods, and pretty much all the Western world does this, the chemicals that we put into foods really mess up our body's physiology, okay? So try to limit your intake of ultra-processed foods. Don't really have time to give a nutrition spiel here, but if you look at some of the resources that I give you, like for Mayo Clinic, Cleveland Clinic, those are all going to be a slide later, look at foods to help you feel better during menopause, because it really does give you a good list. Exercise is really important, particularly with your mood. Exercise releases endorphins. If you'll exercise about 30 minutes a day, and I'm not suggesting we all go start training for a marathon or anything, but just getting your heart rate up about that 30 minutes every day releases endorphins. It also helps your blood pressure, your blood sugar, and your cholesterol. So those things all improve with exercise. Now, disclaimer, you should not begin any strenuous exercise regimen without talking to your personal healthcare provider, okay? Because you may not be safe for, maybe your hip's just barely holding on by a thread, or maybe you've got a cardiovascular issue. So when I say this as a blanket statement, please understand that what I mean is everything is followed by if it is medically safe for you at this time, okay? Next slide, please. Okay. We can't help if we don't know. Y'all, don't be embarrassed. If you live long enough, you're going to go through menopause. You're either going to go through menopause because your ovaries give up the ghost or because somebody takes them away from you. I mean, that's just the reality of it. So we should be talking about this. Your healthcare provider, once you have a birthday of about 42, 43, should be asking you, are you having any symptoms? Do you have any concerns about your reproductive health? If they're not, ask them. Hey, what do I need to be thinking about here? What might I anticipate? Okay? There are a ton of treatment options. If you are having hot flashes, night sweats, we can treat vasomotor symptoms with hormone replacement therapy. Not everyone is a candidate. If you have certain cancers, you personally have certain cancers. If there are certain cancers in your family, if you have uncontrolled high blood pressure, if you have a history of a blood clot or migraines with aura, you can't have estrogen. So that's why this has to be a discussion with you and your provider, is because we have to know what is safe for you based on your history. This is not everybody gets a Premarin. It's not how this works, okay? So really know that we can treat symptoms. Non-hormonal treatments, for those of us that are not candidates for it, there's SSRIs, which are your things like paroxetine, which is Paxil, Prozac, Lexapro, meds that we use to treat moods. Those meds can help with the emotional ups and downs of perimenopause, but they do also impact those vasomotor symptoms, those hot flashes. So if you come to me and say, my primary problem is that I hate my husband and I cry all the time, and I get hot flashes, I'm not going to give you estrogen. I'm going to give you an SSRI. If you come to me and say, everything is awesome, but I have to change my clothes 4 times a day, we're probably going to talk about estrogen. Okay, so there's lots of different things that we can do based on your symptoms, but we have to know what your symptoms are. There is a really cool drug, I'm not a drug rep, but it's called Veozah. It was formulated to affect the temperature regulation center in our brain. It is not hormonal. So for my female patients that have been suffering for literal years with nothing to be done because they can't use hormonal replacement therapies, Veozah is a really good drug and it works well. Is everybody a candidate? No. We have to monitor liver function and some things like that. But don't just think that the only thing to treat hot flashes with are hormones, because that's actually not true. We've got some new drugs coming out. Okay? Next slide, please. Not everybody needs a pill, y'all. If your quality of life is awesome, if you are mildly annoyed but not truly affected by any of the symptoms that you're having, we don't need to give you a pill. Everything we can give you to treat a symptom has side effects, has potential risks. There is not a drug. Has anybody ever read an insert on a bottle of Tylenol? If you read that insert on the bottle of Tylenol, girl, you're never taking another Tylenol. You're going to be convinced that you're going to take that Tylenol for a headache and you're going to die tomorrow. Everything has side effects. The other thing that we really have to consider with these things is what other medicines are you taking, because drugs have interactions with each other. And so some drugs absolutely can't be used with other drugs. So just knowing that is very, very important. We can do lots of things that have to do with, if the only issue is pain during intercourse, we can talk about that. There are lubricants, coconut oil. Y'all, can I just make a plug for some coconut oil real quick? I learned this from a nurse practitioner that had been a women's health nurse practitioner for a very, very long time. And she was also one of us women of a certain age. And what she said was she had tried literally every over-the-counter vaginal lubricant known to mankind. Nothing worked, but coconut oil did. She uses coconut oil after she gets out of the shower, just like we put lotion on our arms and face cream on her face. She puts just coconut oil that you're going to buy at the grocery store on her exterior vagina, labia, That helps keep that area moisturized, prevents the dryness, prevents some of the tearing and some things that can happen during intercourse. And she also uses it as a lubricant during intercourse. It's pH neutral, it's natural, it doesn't have any icky chemicals, okay? So it's something to try if that's something that's concerning. Another plug for something else that I find to be very helpful, again, I have no financial, nobody's giving me any money for this, y'all. I'm just gonna put it out there. There is a eating plan called the Galveston Diet. This lady has a social media presence. She has several books. It's an OBGYN, so again, knowing where you're getting your health information, right? She is an OBGYN, and she told women for years and years, just eat right, exercise, your menopause symptoms will go away, you'll be fine. And that was all fine, well, and good until she became a woman of a certain age, and she was doing everything she told everybody else to do, and it wasn't working. So this is super helpful. I use it personally. If I follow her directions, y'all, I might have 1 to 3 hot flashes a week. If I'm traveling and I'm eating junk because it's convenient and I'm traveling, I'm gonna have a hot flash about every 30 to 45 minutes. That's how much of an impact it makes for me. Now, you guys aren't me, you're all different. We all have different causes and physiologies and stresses and struggles. I'm not guaranteeing that this will work, but it is something that has very little risk, potentially high reward for a very small fee. I think the book's like $29. Yes, ma'am.
She just started a challenge where she's like, it's free to join. You sign up and she sends you like daily things.
Ooh.
She just started in January.
That is fabulous. Definitely check that out. But again, it is something that we can do to make ourselves feel better. Now, I'm not saying do it instead of coming and talking to your healthcare provider. I want to see all your smiling faces. Come see me, talk to me. But stuff that you can do. And I find that when I give my patients stuff that they can do, they feel very empowered. It's something they can, I don't know about you guys, but when I started going through all the perimenopause stuff, I thought my body's an alien and I have no control over anything, what is happening, right? So it gives us something that we can do to control. Is it magic? Not necessarily. Yes, ma'am.
May I just offer to the point of Mary Claire Haber, this book, The New Menopause? It is phenomenal. She normalizes everything you're saying.
Mary Claire Haver. And what's it called?
The New Menopause.
The New Menopause. Okay.
She's the one who created the Galveston Diet.
Yeah.
Okay.
Phenomenal, though. Phenomenal. Yeah.
Next slides, please. All right, it's just us girls. All right, guys, we have got to talk about the guys. All right. Now, this is no disrespect to the guys. I have been married to my husband of 30 years. I love him immensely. He is 51. He's 51, y'all. He's 51. All right, so we're going to talk about the guys for a minute. Next slide, please. So many times we fail to realize that it's not just us that's going through all of these physiological changes that make us miserable, okay? Menopause is a thing, okay? It's a colloquialism. You're not going to find it in any scientific journal, menopause, but there really is big shifts. Their testosterone levels do drop, okay? Now, for situational awareness, a normal testosterone in a male is anything between 195 and about 950. That's a big swing, y'all. But those normal testosterone levels are normed from 18 to 90. Okay, well, you would hope that your 18-year-old had a little more T than your 90-year-old. Okay, so it has to be interpreted in context of not just as what normal, but what is normal based upon age. So oftentimes guys will go, well, I went and got my T checked and it was normal, so I'm fine. Well, not necessarily, because if you're in your 30s and your testosterone is 220, that's low. Your T should not be that low. Consequently, if you're 65 and your testosterone is 900, you've either got a tumor or you're taking something. So it's relative, okay? But as testosterone levels drop, it causes decreased sex drive, it causes difficulty with erections, difficulty achieving erections, difficulty sustaining erections, difficulty having orgasm. These are all things that happen to the guys in middle age, okay? Fatigue, that's a big thing with my male patients. Weight gain, they get the little beer bellies, okay? Mood changes. Guys get moody in middle age a lot of times, and it can be hormones. Next slide, please. All right. Y'all, When guys have difficulty with erections, achieving orgasms, their self-esteem goes massively into the toilet, okay? It is not about you. This is a failure of his physiology. I've been doing this a long time. I have never had a guy come in, sit down, look at me and say, Ms. Tickner, I'm not attracted to my wife anymore. I just can't get an erection. Never have I once had a guy tell me that. What they come in and tell me is, and they're embarrassed, I can't get an erection. I can't sustain an erection. I love my wife. I'm attracted to my wife. My wife is beautiful. This is not about her, but my body won't cooperate. But what happens is, y'all are being intimate, things don't work as planned, we take it personally. He thinks I'm fat. He's not attracted to me. He doesn't love me anymore. He must be, looking at things he shouldn't or attracted to somebody he shouldn't. And we make this about us. Y'all, it's not. It is absolutely not. So if he's having trouble, he needs to talk to his healthcare provider, because it could be testosterone, but it could also be a circulation issue. If guys have high blood pressure or high cholesterol, blood flow to the penile artery is affected. So sometimes it is strictly like they're not getting blood flow where they need it to sustain an erection. That's got to be figured out by their doctor. It could be a nerve issue. My guys that have, I'm a military spouse, so this is where a lot of my reference comes from. My guys that have lower back injuries from jumping out of airplanes or whatever else caused their lower back issue, the spinal nerves that feed out from there in the lower back, those are also the same nerves that feed the male genitalia. So it could be a nerve issue from a spinal injury. It could be a medication side effect. When guys take things like sertraline which is Zoloft or Prozac, some of those other medicines, it can cause erectile dysfunction. So can some blood pressure medicine. So if your husband's on blood pressure medicine and all of a sudden you guys are having trouble in the bedroom, it could be a side effect of that medicine. So have him talk to the doctor. It could be so many things, but none of those things are named you. Okay? So what you have to do is you have to take the emotion out of this. You have to accept that this is a physiology problem, not an Alex problem. Okay? This is a physiology issue, and we need to work together to address the failures of physiology that are leading to this difficulty with our sexual relationship and our marriage. It's hard to do. I'm not saying this is easy, but it kind of becomes a self-feeding monster, right? Because it happened, and I'm just going to tell y'all, this happens to every man that ever walked at some point in time. No one is free from this. But what happens is, it happens once. We assign emotional value to it, both the man and the woman. There's emotional value that gets assigned, and then it becomes a self-fulfilling prophecy because they worry. Well, what if it happens again? Well, what if I can't do it? And then they get in their head about it, and then it becomes a self-fulfilling prophecy. So if it happens, what I want to challenge you guys to say is, honey, that's really okay. This is not your fault. It's a physiology issue. It happens to everyone, right? It's going to be okay. Let's just take a step back, talk to our healthcare providers. It's going to be all right. Because when you assign that emotion to it, that really hurts both of you, okay? Yep. Anybody tired? Yeah, everybody tired. Okay, next slide, please. Fatigue is not a benign condition, okay? Something is causing it. Has real physiological effects, has real psychological effects. It's caused by psychological issues. It's caused by physiologic issues. We have to tease it out. And when you're tired, everything else becomes harder. If you're tired, talk to us. We got to figure it out, okay? Next slide. Physiologic things. Next slide. These are some of the things we can control, okay? If your mattress is 25 years old, if your pillow is uncomfortable, if it's too hot or too cold in your room, if your spouse snores, send him to his doctor. If he doesn't have sleep apnea, they make these little mouthpieces called Z-Quiets that are miracle appliances. Look it up. It's good. Are you drinking alcohol or caffeine within 6 hours of going to bed? Probably, if you have that glass of wine with dinner. Medication side effects. If you have a cold, y'all, and you take Sudafed at 6 o'clock at night, you may not go to sleep because Sudafed is a stimulant. So just keep that in mind as well. And then anxiety, stress, depression. That all affects you. So track your symptoms. Do you wake up tired or become tired as the day goes on? Those are two different causes of fatigue. Do you have trouble falling asleep, or do you fall asleep easily and then have trouble staying asleep? Does your fatigue start after taking a new medicine? If you just started a medicine and you're all of a sudden tired all the time, that's pretty likely the culprit, okay? Do you feel tired before or after eating? That could be a blood sugar issue. Check that out. When did your fatigue develop? Has it been going on for weeks? Did you get an upper respiratory infection and then since then you've been drained? May have had COVID. If you've had it for years, there's something else going on. It could be something called chronic fatigue syndrome. We don't have time to talk about that, but it's a very real thing and a lot of people suffer for it, okay? Next slide. Oh, you got it, okay. Consistent sleep-wake cycles. Please don't lay in bed and doom scroll. Yeah, we're all guilty. I'm looking at all of us. Yeah, me too. Okay? That stimulation from the flashing lights on your screen and the neurochemical stimulation that happens from processing all the doom scrolling keeps you awake. Okay? Don't use caffeine, follow a healthy diet, exercise, but not within 3 hours worth of bed, because if you exercise and then try to lay down, your endorphins won't let you go to sleep. Get counseling. Okay? I'm having to speed up because I'm looking at the clock on the wall going, uh-oh. Okay, I told y'all I like to ramble. All right. Weight. Next slide. It is a multifaceted thing, but I swear to goodness sake, if I hear one more professional say, well, just eat right and exercise, I'm going to smack them. Okay? If that were true, if all you had to do was eat right and exercise, then every single time you lived on salads, vitamins, and spent an hour a day at the gym, you would be a size 2. That's not the truth. Is it an important part of it? Absolutely. Is it the whole story? Absolutely not. Have we been lying to people for decades? Yep. Now, in our defense, we've only really understood all the hormones and the leptins and ghrelins and all those things for about the last 4 or 5 years. So we really are, obesity science is kind of in its infancy and we're learning more and more and more. But please, if your healthcare provider tells you to just exercise and eat right, fire them. Come see me, okay? Don't buy that. Next slide. And next slide. Okay. We're beating sleep to death, but y'all, it's evil. It is the culprit for a lot of our evils, okay? So really work on that. Diet, we've talked about a little bit, but how many of y'all drink sugar-free beverages? Use artificial sweeteners? Diet Coke? Anybody? Artificial sweeteners promote insulin resistance. Insulin's a hormone secreted by your pancreas. It helps your body regulate your blood sugar. Your body can't use insulin as effectively if you're using a lot of artificial sweeteners. So people say, well, I'm not drinking a Coke, I'm drinking a Diet Coke. Great. You're not getting the calories from the Coke, but you are more prone to insulin resistance because of the chemical effects of the artificial sweeteners. So just be aware of that, okay? Next slide. Just some things to talk to your healthcare providers about, questions to ask. Next slide. I want to touch on this real quick. Do Wegovy and Zepbound work? Yes. Yes, they do. People will lose about 15 to 20% of their body weight on average. They are not safe for everyone. Yes, you do have to stay on them forever. So coming to me and saying, I want to lose 20 pounds, put me on some Zepbound and then take me off, I guarantee you within 2 years you will gain back every pound. Okay? It is not a quick fix. It's a decision you make long term. Okay? Yes, they're expensive. You definitely need to talk to your doctor, see if it's safe for you, but there is help for people that truly have overweight and obesity because their leptins and ghrelins are all jacked up. They're great drugs. So if you think that may be you, ask your doctor about it. Just please, y'all, talk to a real person face-to-face that knows you and knows your health industry. Do not go online for Roe or Hers or any of those places without having a physician directly supervise you. Okay, next slide. I want everybody to get things checked out. I want you guys to take a picture of this slide, please. I'll duck. But take a picture of this slide.
Are you posting your slides?
If Cassie will do it for me, I'm happy to share my slides. Okay. All right, next slide. Oh, sorry. All right, so circling back to our hashtag blessed thing. What does it mean to be #blessed in terms of your health? I think it means seeing God at work, whether you're sick or not. Okay? Knowing that no matter what happens, what comes our way, God's with us. We are not navigating this alone. I have seen God turn health hardships into opportunities for blessings for us and for others in so many weird and wonderful ways. Sometimes that blessing for you is in slowing down and taking a breath and deepening your relationship with God. Sometimes it's in allowing others to be a blessing for us in our time of need, allowing somebody else to pick up our rucksack and carry it a little ways. I've seen God use serious illnesses to prepare someone to help someone else. Super quick story. My daughter got real sick when she was in high school, and it took us about 18 months to figure out the multitude of things that were going on with Abigail. And I will be honest and tell you guys, I begged God, please give this to me. Please take it. I'll take all of it for her. Please take it away from her. Please, God, why did this happen? And I got a little irritated with God, to be honest with you, okay? My daughter's a junior in high school. Her best friend and roommate was diagnosed with some of the same health struggles. And because of what Abigail had been through, she helped Ellie navigate that. And Abby will tell you, I don't regret the health struggles that I had because it let me bless her. So even when it just really is incredibly frustrating and disheartening, there is a blessing down the road. You just don't know it yet, okay? And finally, when our physiology fails for that final time, the most incredible blessing is that knowing as Christians, we get to go meet our Heavenly Father. And that, to me, is the nutshell of #blessed. Okay? All right. So remember, final thoughts. I got to give them quick. All right. We can find blessings even when our physiology fails. We need to lean on and pour into one another. As women, as sisters in Christ, we need to do that. Your physical health matters. You have got to take care of you. And this is emotional blackmail, and I'm okay with that. The value you assign to taking care of yourself is seen and adopted by your daughters. If your daughters see you ignore your health and your well-being, they assume that is what they are supposed to do as adult women. If your sons see you sacrifice your health for everyone else, your sons learn that that is the expectation to have of their wives. Think about that. Okay. Stay on top of your preventive health screening. Speak up if you have concerns. Ask questions. Seek reliable information. Take a picture of this slide as well. You guys, I am so incredibly grateful and honored that y'all let me ramble on for 59 minutes today. I can't believe so many of you came to listen to me talk. I am so passionate about women and empowering women to take care of themselves, to love themselves, to care for themselves. You can ask me any questions that you want. I'm happy to answer them. I got to get off the stage here. But please, y'all, women's bodies are wonderful gifts from God, and we need to steward them well. Yes, ma'am. I work at Munson Army Health Center. And nothing I said in the context of this conversation reflects the views or opinions of Munson Army Health Center.